Well, good day, viewers. Welcome to 284 Media. I am your host, Kamal Haynes, and on today's featured interview, we have joining us two very special guests, National Epidemiologist, Ms. Harmonie Brewley-Massiah, and Chief Environmental Health Officer, Mr. Lionel Michael, who's here to speak about mosquito-borne diseases here in the British Virgin Islands. We get to all those details right after a quick commercial break.
Just give me my service. Yeah. Just give me my service. Just give me my service.
Make the switch to CCT and get connected today. Unlimited talk, text, and data. Visit any CCT store or call us at 444-4444. CCT, Life Unlimited.
As the winds start to whisper of approaching storms, it's time to safeguard your sanctuary.
Hey, have you checked your insurance policy lately?
Not recently, why?
It's very important to check your insurance policy before the hurricane season.
That's a good idea. I'll reach out to my provider and get some information.
Awesome. Come, son, let's plan for emergencies together. We're gonna include your favorite comfort kit.
Thanks, Dad. That makes me feel safer.
We're packing extra medications and extra batteries for your hearing aid.
And by the way, don't forget my glasses.
Okay, Pops.
Alright, let me see. Okay.
Going on, dog? What you saying? You good? You got truck? How you on here doing?
I hear trimming some of the branches to make sure they don't cause a frig when the storm come.
Fair point. I gotta go clean out the gutter them down by me so nothing don't build up. You know how that could go sometimes.
Makes sense. That sounds good. We gotta be prepared.
Facts.
Sometimes we get off track, but that's okay.
Yo, thanks for chilling with the dog today, you know.
Man, anytime, you know I got you.
Yeah, but the place so damn hot now. And you know the old people them say when it's so hot, a storm somewhere out there coming.
Listen, I rebuke that in the name of great God of the universe, okay? Let me move these stuff so they don't cause a problem.
Alright, me want my neighbor window get knocked out and
Facts.
Mr.
Remember, we're in this together. Reach out to your community, lend a hand, and shield each other from the storm's challenges. A message from the Department of Disaster Management and 284 Media.
Well, welcome back, viewers. As promised, joining me here in studio is National Epidemiologist, Ms. Harmonie Brewley-Massiah, and Chief Environmental Health Officer, Mr. Lionel Michael. Well, thank you, Ms. Brewley-Massiah and Mr. Michael, for joining us here in studio to speak about this very important subject, mosquito-borne diseases here in the British Virgin Islands. And I'll start with you, Ms. Brewley-Massiah, as it relates to the current status of mosquito-borne diseases in the British Virgin Islands. Can you provide us an update on that status as it relates to such diseases, especially specifically as it pertains to dengue fever, as we would see in the region somewhat of a spike across neighboring Caribbean islands as well?
Well, you're correct. We have been having an outbreak amongst the LAC, that is the Latin American and Caribbean countries. So places like Barbados, Jamaica, Trinidad, St. Vincent, some other countries have all reported that they have been seeing increases in specifically dengue cases. BVI has been no different. We've actually been seeing slight increases from June until about the first week in September, and it has actually started to decline. To date, we had in total about 83 cases, and approximately about 23% had to seek hospitalization. With respect to our severe cases, luckily for us, those have been very, very few, under 5. What else can I say about dengue here in the territory?
And I know you only mentioned about the 5 very severe cases. Had we reported or have we had any deaths reported as it pertains to such?
We have not had, fortunately enough, any dengue specific mortality, thankfully. When it comes to the other mosquito-borne diseases like Zika and chikungunya, we have not reported any Zika cases, but we have had 1 report of chikungunya.
Okay, and if you was to look at in terms of this year compared to the previous year in terms of the numbers, would you say that is it a rise in the previous years or is it now a decline?
Well, looking at the historical patterns, so for the BVI, we have seasonal patterns when it comes to our mosquito-borne diseases, especially dengue. So usually from late May, we start to see increases, and it usually declines around September, October. Then we have a lull, and then we see another peak December all the way into February. And those usually coincide with our rainy seasons, as well as our very, very dry seasons. For various reasons. Obviously, when it's raining, then we have a lot more water bodies being created. And then when it's very dry, we have persons, due to the water shortages in the BVI, we have persons that are, store water in containers and they don't necessarily cover them properly. So then we have that proliferation of breathing.
Okay. And before I get to you, Mr. Michael, speak also too as it relates to the symptoms that you've been seeing that have been reported so far as it relates to those persons who contract dengue fever.
That's a good question. So dengue fever actually has symptoms that are similar to influenza, flu, or COVID. So you will get things like the fever, specifically we get fever, headache, the rash, the muscle pain, the joint pain, sometimes the eye pain. Specific to the BVI, we have been seeing those symptoms, but the most prevalent symptoms we have been experiencing amongst our cases has been the fever, has been a very bad headache, the muscle and joint pains. For the severe cases, what they have been reporting, they've had blood in their vomit, weakness. We've actually had some that reported loss of consciousness. And usually for severe cases or severe symptoms, those usually tend to come on after like the fever as some of the more milder symptoms have abated. So you might feel yourself start to recover, but then you suddenly start to feel very fatigued, very weak. You might again have some dizzy spells, the blood in the vomit, feel very nauseated. Those are all signs that it might be going into that arena of severity or increased severity.
And before we move on that, I know, for example, too, I know while you may not be a doctor, I know oftentimes when persons tend to have those particular symptoms and they're accustomed using medications such as aspirin, doctors would tell you do not use aspirin and those type of medications when you are, if you are diagnosed with dengue fever, but oftentimes persons aren't too sure, as you would have mentioned, those symptoms are so similar to other illnesses that persons may self-diagnose themselves and misdiagnose themselves in the process as well.
That is a very good comment, which is why we always advise for persons to please seek medical care. Find out specifically what it is you are dealing with and get the appropriate treatment, because like you rightfully said, these symptoms are similar to the flu and COVID. So you might start off with a fever before the joint aches and pains start to kick in, and then maybe you take an antibiotic, right? But it might not be a bacterial infection. It might not even be viral, but viral in terms of flu. So you must seek medical attention to determine what it is you have so that you do not take medication that could exacerbate symptoms or your condition.
And Mr. Michael, we would have just mentioned, spoken in depth about the rise in cases regionally and in terms of the 80 plus cases here in the BVI that have been reported so far in 2024. Could you walk us through the current vector control strategies in place in the territory to reduce mosquito population, and have these strategies been intensified in light of the recent spikes?
Yes, thank you very much for that question. We are very much aware that dengue fever is closely related to mosquitoes, and particularly the Aedes aegypti mosquito. The control, to answer your question specifically, we are into chemical control, we're into education of the general public, and when we do house-to-house inspection, we do educate the people. We're into mechanical control, where we advise people, we try to advise people to screen their homes and put up screens and so on. Into physical control, where we advise source reduction, environmental control, clean up the environment, cover containers, and so on. Into I talk about the chemical control, where we do house-to-house inspection, where we destroy breeding places, either by the use of chemicals or by the overturning of containers. We bring the attention to public works, to water and sewage. We collaborate with these agencies, because some of them are guts and drains and so on. We also carry out under the chemical control, we carry out fogging operations. So to answer that question specifically. But let me look at the mosquito, because in the BVI, we want people to focus specifically on the Aedes aegypti mosquito. There are other mosquitoes that bite, and there are mosquitoes that are nuisance to people. And we are aware of those, and so we are dealing with those also. But specifically the Aedes aegypti mosquito, which is the vector that transmits dengue fever. And Harmonie spoke about dengue fever and people infected and so on. Once you're infected by, once you have dengue fever, you have to protect yourself now. You have to wear long sleeves and long pants and screen your homes and use repellents and so on, because you don't want other mosquitoes any more mosquitoes to bite you. Because if other mosquitoes bite you, you now infect those other mosquitoes.
And that's once you're diagnosed with dengue fever?
Yes, once you have dengue fever. Even though you're diagnosed, you have the symptoms, right? So once you suspect dengue, let me use that word. Once you suspect dengue, you should take immediate action in protecting yourself.
And how can persons identify the Aedes aegypti mosquito?
Okay, good question. I was going to come to that. First of all, it lives around your home. It's one of the mosquitoes live around you, around us. We describe it as domesticated. Around your home, inside the home, outside. If you have flower vases in your home, it will live in there. If you have flower vases in your kitchen, in your dining room, in your bedroom, they will live there. Outside, on your premises, if you have litter, if you have drum, barrel, buckets, all derelict waste on your property, they will live, they will breed there. So, around your home, how it looks: adult, you have black, you have white stripes, right? You can't miss it. It's something, if an insect land on you, and sometimes you can see it on your hand, and in black and white, you know that is the Aedes aegypti mosquito. Another thing about the Aedes aegypti mosquito is that it is persistent in trying to bite human beings.
You want to
around you, and you wouldn't let up. You don't get to your head, you gone into your ankles, or your wrist area and so on. And you wouldn't let up. So you can very much know that's the Aedes aegypti mosquito, right? So the adult one is black and white. And the thing about the Aedes aegypti mosquito is that it lives for a whole month. One mosquito lives for a month. The life cycle is from about 7 days to 13 days. So what happened now? With climate change and climate variability that's going on around the world, that 7 to 13 days has been reducing to 5 days, 4 days, and so on. That means we have more mosquitoes in a shorter time.
Okay.
All right, so those are the established ones. When the mosquito lay eggs, which you may or may not see around your home, the officers will see this, the vector control officer will identify them. He lays one mosquito, collects 300 to 700 eggs during his lifetime. One mosquito. And when we talk about mosquito infestation, we're talking about a lot of Aedes aegypti mosquito around your home, and around the community. Also, when it lays eggs, you don't put them in one container. You don't come to your home and lay them in the drum alone. You put them in the barrels, you put them some in the flower vases, you put some in cans and bottles that are available. People are using a lot of gallon bottles now to store water, especially the farmers are using a lot of gallon bottles to store water, and we are finding a lot of mosquito, Aedes aegypti mosquito breeding in those bottles because they're not covered, they not have the cork on them to prevent mosquitoes accessing them. So it puts its egg in several places so that to enhance and ensure its survivability. So that is why when the officers go to do inspections, and when we educate the public, we tell them to clean up their surroundings. It can move from its breeding place up to 400 meters. Generally 200, but it can go up to 400. And so if you breed in mosquitoes, yes, one mosquito.
And that's a very large, if you think about a track and field, a track, 400 meters is the entire track.
Exactly. So you can, so if you have mosquitoes, so it's important that the entire community get involved and fight this mosquito and clean up the community. Because if one premises is clean, right, and other premises are not clean, they will go to another premises.
But that was my next question in terms of the feedback and the receptiveness to your inspectors as they go around the properties and stuff.
The response is positive. We don't have any.
And how receptive are people in terms of, okay, well, you gave them the advice and then you come back in a week or two, you actually see them following through with the advice?
Yes. I have to say the people are receptive to the officers, especially now dengue is in the air. I would generally find that. People tend to be more receptive at times, unfortunately, more receptive at times when you have these cases. We want people to be consistent and persistent in their response to the vector control officers as they go around and the environmental officers are going to do inspections. Because that's how we're going to prevent dengue. If we eliminate and keep the Aedes aegypti mosquito to a very low level, so that even though somebody come into the country with dengue, or somebody diagnosed with dengue, or somebody suspect they have dengue, chances of Aedes aegypti mosquito bite them and transmit the virus will be greatly reduced.
And what are some of the hot spots that you guys have identified so far?
Very good question. Again, Aedes aegypti mosquito is ubiquitous. It's all over. All right? But to specifically answer your question, we look in places like East End community, East End Lamlook community, and general surrounding areas, and so on. We're looking at Lower Estate, Huntham Gut area. We have dense population, where people live close together and so on. We're looking at places like Puzzle Estate there and Duff Bottom. That's Duff Bottom. Free Bottom is up here, right? Yes. Free Bottom. Free Bottom, right. And Puzzle. We also look at Duff Bottom too. And we also have, I mentioned Seacoast Bay.
Seacoast Bay.
Yes.
Okay.
Those are the areas that we would say of immediate concerns, and the other areas which we are focusing on. We're not just, our attention is trying to reduce incidences in those areas, mosquito breeding in those areas, but we're doing nationally.
Okay, and before I get back to Ms. Brewley-Massiah, Mr. Michael, I know the last time I would have spoken to you as it pertains to the machinery as it relates to the tools for the control, for the vector control.
Yes.
I would have spoken to you about the fogging machines and stuff. What update can you provide to us now, considering the last time we would have spoken about such? I know there was several maintenance issues that would have caused those devices to be very inconsistent when it comes to functionality.
Yes. You're perfectly right, and we have resolved those issues. We're happy to say that we have resolved those issues in the ministry. We have gotten the support, very strong support from the ministry and the government to purchase equipment and repair equipment. We have found technical officers, a technical officer in the BVI now, who is very skillful in repairing these machines and maintaining these machines, and we have engaged him. And so presently as I speak to you, we have 2 machines operating on the BVI now. One we call a thermal fogger, or one is a white smoke, and the other one is a ULV that you don't see the smoke with that one.
Okay.
We have one operating in Anegada, and if the situation get out of hand in Anegada and need reinforcement, we can always ship machine down there. In addition to the operation machine that we have now, we also bought 2 new machines. We have received one 3 weeks ago, a newborn one, and the other one is on its way.
Okay.
To be shipped. So we are very much equipped in terms of fighting the adult mosquito in the BVI. Very much equipped. We're also very much equipped to deal with the larval stage of the mosquito. And third, we want to get the public equipped to deal and fight the mosquito breeding places on their premises.
Okay. And in terms of like those sister islands such as Virgin Gorda, Jos Van Dyke and stuff, what is the strategy in place for those?
The strategy we don't have workers we don't have workers in Jos Van Dyke, but we visit residents very periodically based on the level of mosquito infestation, and we will take machines over there and carry out fogging operations. We have worker in Virgin Gorda, and we work along with Green BVI in Virgin Gorda. We don't have a machine of our own in Virgin Gorda. We do have a machine here that we can always move over to Virgin Gorda and carry out fogging operations in Virgin Gorda. Same for in Anegada, we do have workers in Anegada, and we have a fogging machine based in Anegada, and we have transport in Anegada for them to carry out fogging operation in Anegada.
Okay.
And also again, we can reinforce those with those machines that we have on Tortola.
Okay. And Ms. Brewley-Massiah, as it relates to, we would have just spoken about some of the sister islands. I know initially you would have given me the statistic as it pertains to the overall cases reported thus far. Does that include some of those sister islands as well?
It does, but majority of the cases are on Tortola. And there was something that Mr. Michael said that I think we tend to gloss over when it comes to diseases, the increasing global temperatures, climate change. Now, especially for mosquito-borne diseases like dengue, what they've been seeing is not just an increasing proliferation, right, of the mosquito, but also the geographical expansion of its territory, meaning we're seeing the mosquito in places that we would not normally see it. And we would expect to see that here in the BVI as well. But outside of even just dengue, when we talk about this ecological shift, we're also going to see that shift in other mosquito-borne pathologies or diseases like Zika, chikungunya, yellow fever, malaria. We have to expect that sooner or later these vectors are going to be in the BVI. So these preventative and control measures that Mr. Michael is talking about is going to cover the entire gamut of these vectors, which is why it's very, very important for the community to have its hand in doing their part.
Okay. And in terms of, you would have spoken about majority of the cases being here on Tortola. With the current mechanisms that you guys have as it relates to the detecting, how would you say how would you rate the current surveillance system that we have in the BVI in detecting dengue fever as you would have described other mosquito-borne diseases in the territory?
On a scale from 1 to 10, it is not as robust as I would like. When I think of a surveillance system, an ideal surveillance system, it needs to be timely, right? And we do have issues with reports coming in from the healthcare providers on a timely and consistent basis, which means that a lot of cases are not being reported to us, which means they're not being reported to environmental health. And these cases are supposed to be reported by law. Under the Infectious Disease Act 2013, all healthcare providers are supposed to report certain diseases by the stipulated deadline. If we don't get those cases and we don't get the demographics associated with those cases, for example, age, gender, district, community, that type of thing, then it means that the public health response is not going to be adequate, nor may it be accurate. Because if we're not getting all of the cases, then it means that what is being reported to us may not be the target communities we need to go into. And that is problematic when we think about trying to quell an outbreak. So it's like throwing water on a house that is not even burning, right? Because we're not getting the entire picture.
Okay.
I want to mention here, Mr. Kamal, that the question, mosquito breeding, Aedes aegypti mosquito, is one of those areas. It offers an excellent opportunity for the community members to get involved, because the mosquito is there, it's in your home, it's around you, it sees you, it bites you in the daytime and early morning and at dusk. So if a mosquito is biting you in the day, you can pretty much be certain it's an Aedes aegypti mosquito. And we are to get involved in reducing, eliminating the breeding places for it and control it in the community. Because when you look back at history, you find that Aedes aegypti mosquito and its diseases during the Spanish-American War killed more people than bullets and other weapons. So, and we have 83 cases. We can probably add a couple more to that.
A couple.
Right? And
so
when people are suspect they have it, even though they're not sure is it, we want people to take action. And the reporting is very important, because if we wait until we get a report that you're diagnosed with dengue, it might be too late.
It's too late.
Because now you may not know, you're waiting on the doctor result. Most doctors will tell you, if you go to the doctor, they will tell you take precaution, we put down repellents and long sleeve and so on. But we want people to do that, because if you're suspect to have dengue, we don't want other mosquitoes to bite you.
Because that leads me to ask then, as it relates to even the cases that you would have identified that reported so far, are these situations where more than one person in the same household then?
Yes.
One mosquito can infect an entire household.
We have had families from the child all the way up to the grandparents being affected.
And that goes back to what he was just saying just now.
So because unfortunately, historically, dengue has been mild. BVI doesn't see a lot of severe cases or dengue-related mortality like other countries would experience, right? So when people hear like dengue-related deaths, they're like, what? Somebody died from dengue? But we have to understand, I think this year is probably one of the few years we've actually seen a significant increase in severe cases, which means, one, because there are certain risk factors that would increase your likelihood of having severe dengue, which can be fatal. One, we have a new type circulating in the BVI. Two, that person may have traveled, meaning they brought a new type back, right? Imported, what we call an imported case. Or three, every time you are diagnosed with dengue, right, it increases your likelihood of severe dengue. So, for example, if I'm bitten last year and I had dengue, and I'm bitten again this year and I had dengue, the third time might not be the charm. I might come down with severe dengue, which is why, and this risk exponentially increases with age, because you know your immune system tends to weaken over time. So we've been seeing the severe cases, some of them in the more elderly faction, but we've actually had some middle-aged young people that have experienced severe dengue.
Okay. And in light of that, sorry, you was about to say something.
Yeah, I was going to say that we are seeing the Aedes aegypti mosquito is with us. It is here in Tartola, in the BVI. It's in our Caribbean islands. The mosquito is there. People bring it back, people travel, and also bring it to BVI. We travel from the BVI to Antigua, to St. Lucia, to wherever we go, and we carry mosquito to these countries. Because they may hide in our suitcases. I'll give you an example. One day I live in Parkway Bay, and I go in my car, a mosquito come into the car. Fortunately, it wasn't Aedes aegypti. I examined it.
Okay.
So I can't get the mosquito out, so I drive, come to town. I went to
DMV.
As soon as I open my vehicle, the mosquito come out. So I bring the mosquito from Parkway Bay. I transport the mosquito from Parkway Bay to DMV. And that happens all the time. Right? So when people are spraying their homes, inside their homes, using insecticides and so on, they have to buy the appropriate ones, and they have to spray the closed closet.
Under the bed and stuff.
Some people open the bedroom door and stand by the door and spray. That is not the way to do it. You have to spray in the closed closet, tap on bottom, shake the clothes, then close the door. Spray and then close the closed closet door. Some people walk in closet that maybe they may not have any door. They have to do under the bed, as you mentioned. They have to do behind the dressing table, behind the chest of jar, behind the nightstand. Whatever structure they have in the bedroom, they have to spray behind those and on top of those. Then they move to the other rooms and spray. Most importantly though, and to reduce insecticide use, is to put screens on the windows.
Screens.
Right, screens on the windows, and the very thin one that mosquitoes cannot come through. Right, so people bring mosquitoes in, and they may bring infected ones. Infected Aedes aegypti mosquito that then bite people at the port, then bite people at various parts of the territory. So the people in the BVI, householders, have to take stock, get serious with this mosquito, because it is there with us. It's around us, and we can prevent it. You need clean water. If he doesn't get water, he cannot breathe. Harmonie mentioned the drought situation, and the mosquito is very clever. And because we know its characteristics, we try to control it. And so the mosquito lay eggs in containers, and a substance is released that glue the eggs of the mosquito to the containers. So some people will take the container, throw the water in it, and say they should wash it out. You have to scrub the sides.
Okay. And with all of this being said, especially as you would have mentioned in terms of residents being hands-on in their part of ridding up the mosquito breeding grounds and potential breeding sites, how frequently are the inspections that you guys conduct, as well as the fumigation programs?
Every day we carry with fog. Every day we do inspections, Monday to Friday. Sometimes we go on weekends. The fogging, we just restart the fogging operations. We have a careful on fogging operations, and we try to do it in a scientific way. Our approach, our policy is to do it in a scientific way, meaning that we will go to Seacoast Bay, or we go to Lower Estate, or wherever, and we assess the area first. We find the breeding places, we destroy the breeding places, we speak to the householders in the area, and then in the same afternoon or the next day, we carry out fogging. We want to destroy the breeding places first. We don't want to go on and fog just like that, because we have to think about the agricultural people, and people who have bees, and people complain about the bees population and so on.
And the asthmatics.
Right. Yes. Well, we put out a notice before.
Okay.
And so we got to be very careful on that and those operations, because we do concern about the ecology and the other environmental sensitive species out there. But yes, so sometimes we have to, of necessity, go to area and fog without us assessing it, because the situation is unbearable in some places. Yes. Some places sandflies biting people, and after heavy rains we have a nuisance mosquito that proliferates, and that's just stick on in your hands and so on. That's not the Aedes aegypti one, fortunately. That's not the Aedes aegypti one, but the nuisance mosquito that affect people. And people don't like mosquito bite, whether it's Aedes aegypti, whether it's Culex, any form of mosquito, the people don't like the bite. We also talk about the travel. Harmonie mentioned travel, and we just heard in the United States that we have another mosquito-borne disease called West Nile, right? And that's transmitted by Culex mosquito, another species of mosquito, which we have in the BVI. And so And that we want to appeal to people now to, while we are fighting the Aedes aegypti mosquito in all its forms, by all methods, we have to take care of our septic tanks that have cracks and leaks and water ponding in the soak away, because the Culex mosquito will now breed in those septic tanks, dirty water and so on. And so the public, the community, the residents have a monumental task, a pivotal role to play in helping to reduce mosquito population in the BVI, all types.
And finally, on to you, Mr. Michael, I know you would have spoken about the fumigation and the other preventative measures you guys use. I know in some places you would have heard it sometime, I think it was 2 years ago at least, as it relates to the particular vector control method of releasing a certain breed of mosquito to basically rid of those types of mosquito.
Okay.
Do we see that practice here in the BVI as well?
We have that project in the, there is a project in Virgin Garden about the releasing male mosquitoes to help control the female Aedes aegypti mosquito. Okay. Well,
How has that been so far?
The reports have been mixed. We're getting an updated report from Green BVI on that situation right now. Right? Short, I should say. But they want to explain that in the mosquito situation, female Aedes aegypti mosquito is the only one that bites. Okay? The male does not bite. The male do what he has to do in terms of producing eggs and help with fertilization, copulation and so on, and then go about his business. Feeds and plants and nectars and so on. However, the Aedes aegypti mosquito, the female is what bite people because they need human blood and blood to fertilize the eggs. So what is done in Virgin Garden or in other parts of the world, they're trying to reduce the Aedes female population by modifying the males, so when they copulate with the female, the eggs of the female are not viable, and so on. So therefore, the population would come down. The female population of Aedes aegypti would come down.
Okay.
Right.
Great. I believe you would have dissected and revealed a lot of information here in today's interview. Both to you, Mr. Michael and Ms. Brewley-Massiah. Any lasting message for the viewing public that you want to perhaps inform the public of something coming up soon as it relates to further preventative measures?
Let me go first. We're going to have these hotspots that you mentioned earlier, and these communities. We're going to engage the communities. We're going to work with the communities, and I put it that way, because I want the community to work with us, and vice versa. We want to work with communities to reduce mosquito population. There's some active groups in some communities, Eastern Langlook Community Group, for example. And we are going to go to these communities on a scheduled basis to work with them, help fight the mosquito population.
Okay.
Yeah. So I think we are scheduled to have 2 community meetings next week, Saturday and Sunday, with Eastern Langlook community. And we really want to educate them on dengue and other mosquito-borne diseases, nuances pertaining to the vector, what public health and environmental health will be doing going forward to help at least maintain the environmental hygiene. And then following that, we actually do want to have a massive community cleanup campaign in those particular communities. I'm talking about whatever's in your yard you don't want, and we're actually partnering with solid waste. So they're going to be coming up with their trucks and their tractors and whatever else to really help beautify the community and get all the waste materials out so that afterwards we can see whether or not what we have done and what community has done has had an impact on the Aedes aegypti numbers as well as the cases that we're seeing coming out from these communities.
And I know you mentioned next week, Saturday and Sunday. Do you have the times as well?
We will be starting around 6:30.
Okay, 6:30 a.m. or p.m. Okay. All right. Well, viewers, I want to thank you so much, Ms. Brewley-Massiah and Mr. Michael, for taking time out of your schedule to come and inform the public on this very important subject matter of mosquito-borne diseases and the current status as it pertains to dengue fever and the other diseases. As you would have mentioned, no other cases of the other mosquito-borne diseases have been detected this year so far. I think one chikungunya, but the rest have been just mainly dengue fever, with 5% of those overall cases being severe, which is a good sign. So thank you so much for that information. Viewers, I hope that you take heed to the messaging here from our national epidemiologist, Ms. Harmonie Brewley-Massiah, as well as our Chief Environmental Health Officer, Mr. Lionel Michael, as it relates to those preventative measures to ensure that your surrounding community and your surrounding areas across the homes are such in a way that you can prevent this increase of mosquito-borne diseases here in the British Virgin Islands. I'm Kamal Haynes. Thank you for joining us. Until next time, bye-bye.